We would all love to be able to turn back the clock, especially when it comes to our health and our vision. Knowing how to slow or prevent the eyes from aging can give you a better quality of life, help you get in better touch with your personal health, and help you to communicate with your doctors so you can come up with the best plan for your health care. Here are 6 of the most common age-related eye diseases and conditions that you should know. One of them might surprise you. Cataracts are a clouding of the natural lens inside of the eye that lead to a generalized blurring of vision. Some people are more affected at near than at distance, and people notice usually the greatest changes at night or in dim circumstances. Usually nighttime driving is the most bothersome. Sometimes there can be shifts in color vision and things tend to appear a little bit more yellowed. And sometimes you can have big shifts in your glasses prescription, feeling like you need to update your glasses every couple of months because cataracts can actually change your glasses prescription as they develop. The prognosis of cataracts is that they will just continue to get worse slowly over time until they get to a point where they're bothersome enough that it is time to remove those cataracts and replace them with a clear synthetic lens. Fortunately, this only needs to be done once in a lifetime in the grand majority of cases. Outside of surgery, there are no other ways to treat cataracts or even prevent them, but you can try to slow the progression by maintaining an overall healthy lifestyle, controlling any systemic diseases, avoiding UV exposure, avoiding smoke exposure, and reducing alcohol intake. Just keep in mind that a healthy body means healthy eyes. Macular degeneration happens when the eye is no longer properly recycling the materials that it uses in order to function. And these materials build up in the macula. In more early stages, there aren't often symptoms, but later on it can cause blurring of vision, distortion, spots can go missing from the vision as well, and it can affect color vision. Now, the macula is responsible for your central vision, so the area that is affected is the central vision, making it difficult to recognize faces, see small details, and read. The prognosis is really dependent on the person and the type of macular degeneration, whether dry or wet, and I talk more about that in this video here, but it can affect vision quite significantly, sometimes making it difficult to even see the biggest letter on the eye chart and sometimes beyond that. As far as prevention, macular degeneration largely is genetic, though there are some things that can help to slow it down, making sure you avoid smoking or secondhand smoke. Do eat leafy green vegetables regularly in your diet. Protect the eyes from the sun. There are supplements available called AREDS 2 supplements that are over the counter. Try to have as healthy of a diet as possible and slow the progression as much as you can by seeing your doctor regularly. Before we continue, thank you so much for watching. Please like and subscribe to help make this video more visible to others who may benefit from learning more about their eyes. Glaucoma occurs when there's damage to the optic nerve, which affects the peripheral vision. We know that the optic nerve can be damaged if eye pressure is high, but that's not always the case. It's also connected to lack of oxygen to the optic nerve. Now, the optic nerve connects the eye to the brain. So you can imagine that if the optic nerve is damaged, it can affect the message that's being sent from the eye to the brain. In glaucoma, what happens first is that it affects the peripheral vision. But if glaucoma becomes very severe, it can actually lead to tunnel vision and total loss of vision in an eye. So you can see the prognosis is extremely variable. If glaucoma is diagnosed and treated early, in most cases, it's usually pretty well controlled with eye drops. The longer you have glaucoma untreated, the more the optic nerve gets damaged, and this nerve damage is irreversible. So once that visual field is lost, it cannot be recovered. So these eye drops are all meant to slow the progression of glaucoma. They can't undo the damage that's already been done. And there are also different types of glaucoma. Some of them are caused by underlying systemic diseases, some by trauma. So controlling systemic diseases and protecting the eyes from trauma are really important. Also maintaining a generally healthy lifestyle. Also, recent studies show that a high intake of caffeine may be a risk factor for glaucoma. So in terms of prevention, trying to control the caffeine intake could be important, but there are no real ways to prevent getting glaucoma. Of course, treating it with eye drops, and there are laser procedures, sometimes oral medications are used, and there are also surgical procedures, but those are usually reserved for advanced cases. Diabetic retinopathy happens when diabetes is not well controlled, or even if it is well controlled, but perhaps you've had it for 20 years or more, then we do tend to see some changes happening in the eyes due to diabetes. And this is because the eye is filled with blood vessels, and it's the small blood vessels that are affected in diabetes by the high blood sugar. So the longer the diabetes is uncontrolled, the more damage we tend to see. The way that it affects vision is really variable depending on what's going on. Usually in early stages of diabetic retinopathy, we just see small changes in blood vessels or small areas of bleeding that don't tend to affect vision. More so the later stages of diabetes, or if there's swelling occurring, that we tend to have changes, or that it tends to affect the vision, and it can cause blurring of vision, sometimes distortion. Sometimes it can cause total areas to be blacked out of vision depending on what's going on, like if there's a really large bleed in a certain area. And in severe stages of diabetic retinopathy, there can actually be a lot of scarring that leads to retinal detachments. And of course, this would cause all those symptoms of retinal detachments like flashes, floaters, and affect the peripheral vision in a significant way, and could lead to blindness if it's not treated immediately. So the prognosis for diabetic retinopathy is extremely variable depending on how well the blood sugar has been controlled or how long it's been uncontrolled. It is very dependent on the control of the blood sugar. And also when diabetic retinopathy was diagnosed. If it was diagnosed at a later stage, it could be a lot harder to catch up and treat the eye and control the changes that are happening. So maintaining just a mild level of retinopathy, if possible, by controlling the blood sugar is the best thing you can do to slow the progression of diabetic retinopathy. But there are treatments available like injections into the eye, and sometimes laser treatments are used, and then any treatments to address complications such as retinal detachments if those do occur. So the best thing you can do is to control your blood sugar. Also, seeing your eye doctor regularly to monitor for changes and treat them rapidly if they are occurring is very important. Dry eye is a lot more complicated than it sounds. To put it simply, it's usually caused by poor tear production by the lacrimal gland, or by too much tear evaporation because there's not a good enough oil coverage to the tear layer, or a combination of these. There are a lot of different underlying causes to dry eye, like the environment, side effects to medications, or autoimmune diseases, among many others. But the important thing to note is that dry eye can actually cause a lot more issues than many think. It's not just that the eyes feel dry. There's a lot more to it than that. Dry eye can actually cause a lot of issues with vision, including a generalized blur or fluctuating vision. Usually people notice this more towards the end of the day or after working on the computer or the phone or reading for a while, especially if there's a fan on. Vision can start to get blurry. You can have a foreign body sensation, irritation, that general dry eye feeling, but it can actually advance beyond that. If dry eye becomes severe, it can actually lead to damage to the nerves in the eye, and the eye doesn't always feel how dry it is anymore. And while that sounds like it could be a good thing because there's not as much pain as there used to be, this actually can lead or contribute to corneal ulcers, which exposes the underlying area of the cornea and makes you more susceptible to infection and can cause all sorts of issues. So dry eye can be a really serious condition. We need a really good layer of tears to give us clear vision, and when those tears evaporate, it leaves the cornea exposed, and that causes the vision to become cloudy. Because there are a lot of different underlying causes to dry eye, it's not always preventable, but if you know it's due to your environment, like air pollutants or a lot of dust, trying to avoid those can be helpful. Also, knowing that it can be a side effect to medications, perhaps there are adjustments that can be made there. And as far as treatments for dry eye goes, it runs the gamut. There are so many different options for dry eye treatments. That's going to be a whole separate video, or possibly many, but there are a lot of different treatments out there, whether it's over-the-counter artificial tears or there are prescription eye drops. Do keep in mind that it is a chronic condition and that it will require regular management in order to maintain healthy, comfortable eyes and clear vision. The last one we're going to cover today is presbyopia. This happens when the lens of the eye is no longer able to focus up close as well as it used to. This happens because the lens of the eye becomes less flexible over time, and the ciliary muscle, which contracts to help the lens to focus, also becomes a little bit weaker over time. So as a result, the lens doesn't change its shape as well, and it doesn't focus on near objects as well. So this tends to start affecting us in our late 30s or early 40s, and it'll affect us at those really close distances. And over the years, it will start to affect us more and more and more, all the way until about arm's length or so. And usually things tend to stabilize around age 55 or so. So you might notice that over those years, as things are changing, you might need to adjust the power of your reading glasses or change the prescription of the bifocal. Presbyopia can be treated by correcting the vision, like with glasses or contacts. And there is a new prescription eye drop out there now called Vuity, which temporarily improves the near vision and is used on a daily basis or sometimes twice a day. So that's a pretty remarkable new change in eye care. But as far as prevention, there's no way to prevent the aging of the eyes, just like there's no way to prevent the aging of the rest of the body. Though you can try to slow the progression of these changes of the lens, wear sunglasses outside, and control any systemic diseases that you may have and maintain an overall healthy lifestyle. Did any of these conditions sound familiar to you? Are there any things that I didn't cover that you have questions about? Comment below and I'll try to answer in a future video. Thanks for watching, and I'd love to see you next time.